Being here today to attend our first Zero Harm webinar of 2024. And today we're going to be talking in a little more detail about our Drive to Zero Suicide Award. This is the fourth year that SCHA will be partnering with the South Carolina Department of Mental Health to give this award, recognizing hospitals for their efforts in suicide prevention in their facilities. Last year, we had 24 of our South Carolina hospitals to win this prestigious award, and we hope that many of you will apply again this year. We will be having a few changes, and we will be talking a little bit about that in more detail in our webinar that will be happening in July, and we'll talk a little bit about that today. But just wanted to, again, just review, last year, many of you know that we celebrated 10 years of Zero Harm. You can see here on this wonderful timeline that we've had a number of different partners that we have worked with and expanded this program. 4 years ago, as I mentioned, we created in partnership with the South Carolina Department of Mental Health an award that recognizes hospitals for their work with suicide prevention. And we just want to recognize all of the partners that you see here on this timeline and on this journey. And we have had a great 10 years, and we're looking forward to moving into the next 10 years of the Zero Harm program. We will be having the same award categories as we had last year in 2023. This year, we will be having the Certified Clinical Awards, recognizing hospitals for the clinical achievements and achieving zero harm in a number of different clinical categories. We will be having our Drive to Zero Harm Leadership Award. And this will be an opportunity for hospitals to recognize a leader in their organization who is striving towards high reliability and zero harm in their facilities. And then we will have our priority awards, and that's where the Drive to Zero Suicide Award will fit under again this year. We will have the Drive to Zero Suicide Award, the Drive to Zero Workplace Violence Award, and the Drive to Zero Disparities Award. And in July, be sure to mark your calendars. We will be offering a webinar again this year. We will go over each of those award categories that I mentioned in detail. We will have a live demo of the application process for those of you that are new that maybe haven't applied in the past for the Zero Harm Awards. And you will be able to access that, through our Zero Harm website. The webinar is going to be on Wednesday, July 24th at 10 a.m. And you can access the registration information at our website at zeroharmsc.org. So be sure to register for that and let others in your organization know about that. Our portal dates will be, the application will be opening Wednesday, August 14th, and we will be closing the application on Friday, September 13th. Today, the purpose is really to talk in detail about the Zero Harm metrics. So we've invited our partners today from the Department of Mental Health, Jennifer Butler, who is the Director of Public Education, and Jessie Barnes with the Department of Mental Health. She is a program manager for the Office of Suicide Prevention. They are wonderful partners that we have worked with from the very beginning and development of this award. They help to provide the validation and review of the applications. And the metrics that you see here are going to be the award metrics that we will be using this year as in past. But there's a number of different resources that you can see for each of these metrics. And we thought it would be great, particularly for those hospitals who may be applying this year and haven't applied before, for our partners to give a really comprehensive review of each one of these metrics and the resources that you can access in order to be able to apply each one of these metrics in your facilities. So at this time, I'm going to turn it over to Jessie and Jennifer and let them give you some great information and talk about the wonderful work that they are doing over at the Department of Mental Health.
Hi, thank you, Nan, for that introduction. We are excited here to talk with y'all today. What this work is so important. So you'll hear a little bit from me and from Jennifer just to go over everything that we can help support with and ways that South Carolina can really grow to be this zero suicide state. So Jennifer has some information that she's also going to share with you.
Good morning, everyone. It's nice to see some familiar names. That means that you've been already implementing life-saving measures regarding suicide prevention in the way that you care for patients. Sometimes when initiatives are rolled out, it feels like it's one more thing that you have to do. But really, zero suicide is about embedding that culture in every way that you care for patients in your facilities. Whether that is the greeter at the front door, whether that's the cafeteria, that's the person coming in and checking blood pressure in the middle of the night. It's not just on the responsibility of an emergency room or the doctor and the social worker. It's really all of our responsibilities, because one touch point in the continuum care can save a life. You don't know if you're simply leaning in to someone to offer a warm smile or a hello, could be that piece that allows them to open up to you or allows them to want to live for another day. So I wanted just to spend a couple of minutes talking about why zero suicide matters in terms of hospital systems, and why we hope that if you have won this award before, that you have been working hard on elevating the work that you've been doing this past year. So nearly 30% of individuals had a healthcare visit within 7 days before their suicide death. 6.5 of those had been seen in an emergency room. 16.3 of them had been seen in outpatient specialty clinics, and 9.5% had been seen in primary care, with over half of those who died by suicide in the nation being seen within the past 30 days. And so the other piece of this is that they're coming into healthcare facilities more often than those who do not go on to die by suicide or attempt suicide. Almost 16.7 healthcare visits in the year prior to their death. So when you think about data, and I should have said this beforehand, when I'm sharing data and when Jesse is sharing some data, you'll hear us talk about numbers, but obviously these numbers represent a human being, a life, and also an opportunity for us to say that was 16 healthcare visits where we possibly could have intervened. And so when you think about your role, remember that it does matter, that again, asking the question matters, but really just being that compassionate presence matters. 1/5 or over 1/5 of individuals make an emergency room visit within 2 months prior to their visit. And again, as a result, you have a lot of opportunity to intervene. When we think about intent, we need to remember that means matter. The South Carolina rate of dying by firearms is higher than the national rate. We know that firearms are the leading cause of suicide death, with overdoses being the leading cause of suicide attempts. And you may be thinking, okay, well, if in our state we already have a higher rate of firearm usage, is it really going to matter if I talk about intent and means? It's absolutely going to matter. In fact, the New York State Office of Mental Health in 2020 did a study and found that patients were 3 times more likely to make safe changes in their firearm storage if they received verbal or written recommendations and information from their healthcare provider. So 3 times more likely. So again, there is power in what you share with those that are being served by your healthcare facility. I want to share just a quick story about why this matters in relation to South Carolina. So Charlestown Pediatrics, which is in the Low Country, adopted Safe Side, which is one of the trainings that we'll talk a little bit more about in the July webinar, but certainly Jesse will touch on why training is part of the metrics. The Safe Side is a training for primary care physicians and practices. And so Charlestown was one of the first practices that did this in our state. And they called me afterwards because they wanted to share a story that I want to share with you now. So they had a mom call. This was after they had completed the training, a 3-hour training, mind you. It was not like it was 2 weeks. It was a 3-hour training. The mom called and said that she was concerned about her 16-year-old son with depression. And the frontline staff said, okay, we can see him next week. Well, the office manager happened to overhear the conversation and said, no, have them come in today. We'll squeeze them in. We need to not wait a week on this. Okay, so already points about, say, acknowledging a risk factor. We've got an adolescent, we've got a male, we've got depression. And so mom brings the young man in, the doctor meets with them. This is a pediatrician, a well-trained pediatrician, but admittedly, as she'd gone through the training, she shared what many of us know now, which is that we don't have as much suicide prevention training or very little in our practice, in our educational careers, whether that's social work or LPCs or physicians or nurses. We need more. And so this doctor asked the young man if he was suicidal. He said yes. And he was like, nobody's ever asked in a way that made me feel like they really wanted to know. So she asked in a compassionate way. And then she asked about means. And he said, yeah, I do have means. I had a plan. One plan was to take my life by firearms. And she said, do you have access to a firearm? He did. Then she asked, she didn't just pause there, but she asked, do you have another plan? He was like, wow, I didn't think you were going to ask me that question. And he said, yeah, it was to drive off a bridge. And he had access to a car. So she noted that because of the work that her healthcare system had done to prepare her and prepare her staff, they were able to intervene, and that young man is alive today. And they really felt like it was because they embedded it in every point of their practice. So we talk a lot about examples and things like that, and usually they're national examples, but I wanted to give you a hometown example. We can do this. It didn't crush their practice. It didn't overwhelm their practice. We can do this. We should do this. I want my loved one, and even myself, if I ever walk into the doors of your healthcare facility, I want them to receive good care. And I know that they already are, and suicide care is part of how we do that. So I'm going to pause there and turn it over to Jessie.
Thank you, Jennifer. That everything that we do matters, and there is an opportunity for everybody on this screen and that web to grow out of what we can do to help people in South Carolina who are having thoughts of killing themselves. And I know Jennifer shared some of the statistics of people who have been seen by a primary care physician or the emergency department here in South Carolina. And I just wanted to give a little background about where South Carolina is right now when it comes to suicide deaths. So like Jennifer said, these numbers are people. They are someone. And when we look at them, they can be hard. And I think that can drive us to see that this work matters. And like we are going to help share some resources so we can help expand that web of outreach and assessment to make sure that these people are seen as well when they are struggling. So in 2022, which is our most current suicide death data that we have, the CDC released this, that South Carolina has had 852 suicide deaths. Now, this was an increase from the previous year. So we do have work that we can do here in South Carolina to really help expand and reach those people. So when we look at some of that data, we look into other ways that we can collect data, because we know 2022 is as real-time data as we can get. So what we were also looking into were ER visits for people who had went to the emergency department here in South Carolina. So to make sure I have all of those numbers correct for you, I had it pulled up. There were, I lost the slide. I'm pulling it up right now. When it comes to the ER visits here in South Carolina, there were 31,118 emergency department visits where a person was showing up that was coded as having a mental health trauma. And that was just for 1 year here in South Carolina, which means that approximately every 17 minutes, there is somebody in South Carolina that is being treated in our emergency department for mental health trauma. We're 85 people a day. We have been on this webinar for 16 minutes. So that's just to give a little bit of a perspective of how frequently these people can be seen and be heard. Like Jennifer said, it matters to be heard and to know that what you are sharing with a trusted person matters and that person's life matters. When we also look up suicide attempts and people who have gone to the emergency department after a suicide attempt, we know that the age range of 15 to 24 make up about 33% of all suicide attempts. And these are just the people that are showing up to the emergency department. So there could be a number of people that we are also missing that might not have gone to the emergency department after a suicide attempt. So that's a little background about what is happening right now in South Carolina. And I hope that this can give a perspective of the different ways we can reach people throughout all that we are doing. Now we're going to go into ways that we can expand what we're doing, ways that we can make sure we have tools that can help people who are at risk of suicide. So we're going to start off, one of the metrics is different ways we can assess people. So I'm going to bounce it back to Jennifer just to highlight some different assessment tools that we can do.
So the Department of Mental Health instituted universal screening back in 2018 when we first launched Zero Suicide. And we have been able to use the Columbia as part of how we screen on the outpatient side. And I see Dr. Breen is here in the webinar today. And so I know, Nan, sometimes I go rogue, but Dr. Breen, if you could put into the chat what we're using on the inpatient side, I would greatly appreciate that. Their pathway is a little bit different because they have very different populations, from our long-term care to our forensics, to our substance use disorder hospitals for our kids, as well as our general adult psychiatric hospitals in both the upstate and in Columbia. But the Columbia Screener is one of the ones that is most used in across the country and across the world. You can do a quick 2-question asking if they have had any thoughts of suicide and if they have done anything to harm themselves today. Even our 988 contact centers are asking these 2 questions. So when we think about screening questions, they're really quite easy to apply to any one of your facilities. And I believe, as soon as there's Dr. Breen. So hopefully Dr. Breen is putting that in the chat, but I know that they also use the SAFE-T on the inpatient side. And we do, again, still use the Columbia on our outpatient side.
And then as we move forward with some of the metrics, I'm going to be talking about different trainings that we can do. And when we think about trainings, it's not just trainings that are for clinical staff. There are multiple different access points that a person can interact with. If I think about myself going through a hospital care system, I may first be making a phone call with the person to schedule my appointment. I may have somebody that is checking me in, and then I may have my treating physician that's going to help me for whatever my needs are. I remember a long time ago, I had a terrible sore throat. I was miserable. And I went to a local urgent care, and I'm going in. My entire focus was on just wanting my sore throat to go away because it was miserable. And while I'm there, the nurse who is doing all of my vitals checks and everything starts going over a screener. And it was the PHQ-9. I knew what it was. And as she starts asking the questions, my energy went up because I was so excited that this was being asked, even with an appointment where I was coming in and my primary reason for the visit was because of my sore throat. I think I startled her a little bit because my energy level did change. I am very passionate when it comes to suicide prevention efforts. And I noticed that as one access point that would have given me the opportunity, if I was thinking about suicide, to have opened up and talked with somebody about it. So that counts as we talk through multiple different ways that we can train different staff, because everybody can have a role. And also in my mind of how the web can spread, if we train our entire staff, you don't just keep that training and learning that you learned only in your work environment. We can interact with people all the time in our communities and carry that knowledge with us. So I'm going to share my screen. So hopefully I have two screens on my computer, so hopefully everybody sees my webpage. So if you go to the Office of Suicide Prevention, which is a webpage that we house through the Department of Mental Health, because you can see a list. I'm in the trainings tab already, and I'll make sure I put this link directly into the chat. We do have a variety of trainings that reach a variety of different needs. Now, I know that this page can be overwhelming, and I'd also like to point out we're not the only provider of trainings. There could be different access points. But if you are ever wanting to bring in trainings, you can always reach out to our office as well to discuss what might be some ways to meet your needs of what you're needing for your facility. So, for example, we have a training here called Safe Talk, and we give a little description about what each training is, just so you can get an idea. It does not tell you everything, because there could be a time where we have an idea of what we might need, but maybe there's a time constraint. So we do open that door for a conversation so that we can make sure we are coordinating with what works. So Safe Talk, for an example, is a 3-hour in-person training that goes over how you can ask somebody and recognize different risk factors or invitations a person might be sending who is having thoughts of suicide. Here with the Department of Mental Health, we have all of our non-clinical staff take Safe Talk, because they could see those invitations, and then the role of a Safe Talk person who has been trained is to connect people with somebody that can provide care and further assessment and treatment. Another thing that we have is a training that goes with Safe Talk in a way, and it is Assist. And it is like the next level up in a way. So if you are a more clinical or might have more of an intervention role when it comes to interacting with somebody who is at risk of suicide, then you can take this training. It is more intensive. It's a 2-day training, much different than 2 hours. And you really go over ways that you can help intervene and work with somebody to keep them safer now if they are having thoughts of killing themselves. So that's just some examples. And we know that those are both in-person trainings. So there are some that might meet your needs that are more in line with online trainings. There is Talk Saves Lives for the workforce, which can go over different risk factors of suicide and different ways you can help prevent it. And this one can be done virtual or in person. So we highly recommend look up some of these, and it might give you an idea of ways that you can incorporate them with your policy. Now, in the July webinar, we can talk about more of what the metric is of the number of people you need to be trained, or if you are attesting that you have shown improvement from a previous year, what that would look like of the improvement numbers. So this will be discussed further detail in the July webinar. But this purpose of the webinar we're in right now is just to give some ideas of different ways that you can go through different trainings as we are helping people and growing what we can do. So I highly recommend to explore this. Also do your own research into different trainings that might be appropriate for what you are needing. But I hope that this gives some ideas. I don't see the chat, but please feel free to put any questions in the chat. And if something does come up, then we'll be happy to answer it. The other thing that we are discussing today is a list of making sure we have resources that are available. So when we talk about developing different policies that are around suicide, sometimes it's also by making resources available to those that are in need of help. So one thing that this website also has is we have a printed resource tab. So these are all PDFs that you can pull up, you can print out more, and really take these resources and distribute them. We have different 988 crisis line flyers. These are ways that people can chat or text or call 988. And a lot of what we have done here within the Department of Mental Health at our different clinics, and what I tell people out in the community, is we recommend putting these types of flyers in the bathroom stalls. We have come a long way when it comes to reducing stigma, and we still have a long way to go. And it might help a person feel more comfortable to take a crisis number if they feel like they're in a bit of a private setting than if we were to have this on a bulletin board out in a public lobby or a waiting room. They might feel like they're being watched or judged. So we found that that just helps people feel like they can take that first step a little bit easier of reaching out to help. Some other things that we have on here, and we do have these resources like the 988 line in Spanish as well, and the crisis text line. We have that flyer in English and Spanish as well. Two other resources I want to highlight. These are not crisis resources. I call them more care connecting resources, because we have, and we are the first state to do this statewide, an interactive mental health questionnaire program. And what that means is we have one that's for people who are 18 and older, and that's this one over here, the blue document. And people can scan the QR code, go directly to the website, and they take a questionnaire that will assess overall mental health, substance use, suicide ideation, past suicide attempts, struggles that they might be having with work and school, eating habits. And once they take the questionnaire, it's not an automatic response of this is what we are seeing. What they're getting is a real person that's looking over those results, seeing what is going on with this person's life, and responding at what level of care might be appropriate, or what needs might they need to address some of the things that are going on in their life. So it's a real person looking at it and responding back. This screener is actually done in partnership with the Department of Drug and Alcohol Abuse Authorities, so the DODAS here in South Carolina. So just to show that it's real people, 1 week they're answering the screens that come in, and 1 week the Department of Mental Health is answering those screens. Not only is a person having a real person respond back to them, but that person may still have questions. They may still not know how to take that next step, or when would be the appropriate time to call, or if they might need other things that maybe the person missed or didn't feel comfortable at first to share on the screener. And they can actually dialogue back. So they can write a message, they can ask a question, and then that person who did the screener can respond back and answer some of those questions. The reason why I'm emphasizing it is not a crisis resource, because it is a real person. Sometimes responses can take up to 24 hours. Now we do them in 24 hours or under, but we are responding to them within that time frame. And we do make sure that we are putting crisis resources on those responses so that they know, okay, if I need to talk to somebody now, here's who I can reach out to. So on the other side, if you look at this yellow flyer that says Hope Connects SC Kids, this is a very similar program that is for people who are 18 and under, and parents or guardians can take it on behalf of that person who is 18 and under. And they can take this questionnaire, they can take it together with the person that they are concerned about. And it is also the first in the nation to do this type of interactive questionnaire with the population of serving somebody who is 18 and under. So it assesses similar things: overall mental health, substance use, suicide ideation. How is this person interacting both at home and at school? And maybe opportunities for addressing any other concerns as well. And then same process, they can have, they'll take the questionnaire, a real person responds, and they can dialogue back with any questions. One thing I've noticed with this one is we do get a lot of parents or guardians reaching out and asking questions because they just didn't know if it was at a point where they needed to connect their child with somebody, or if it was to a place where they needed to reach out, or what are the resources that are in their area? Maybe they live in a rural part of South Carolina. What is available to me here? So this screener is done in partnership with the Department of Mental Health, as well as the Department of Children's Advocacy. And so they answer that both together so that we can help provide resources to different people. So that's just a little bit. And when these kind of things can be incorporated into different policies that we make. When you're looking at your discharge, are you discharging somebody with a resource that they can use if they need to after that discharge? Or you have a way to send out those caring contacts to let somebody know after they have left your facility, hey, we're thinking of you and I hope you're doing well. So these are just, I wanted to make sure that everybody here knew that you can click, you can download, you can put these places, also help reduce the stigma of putting them out there and letting people see. So here's just a little bit of the resources that are tangible and can put up places. Another one, and the flyer's not on here, but I am going to show you the webpage, is one that we call our Hopeful Minds platform. And I'm going to click it, and Jennifer is going to walk us through the Hopeful Mind platform.
Thank you, Jessie. I hope that you all are getting excited about the number of resources that we have that are accessible and free. We want to make sure that resources that are provided to South Carolinians are those that are on a spectrum of care and in a spectrum of need. We want to make sure that we meet everyone where they are, but that we don't leave them there. And so one of the things that we've been able to do is partner with Credible Mind, which is sort of, I call it a life enhancing wellness platform. But it is these resources that are here on this platform that we have branded as Hopeful Minds for the state of South Carolina. You see the word hope in a lot of our resources because our state motto is, while I breathe, I hope. And that is certainly what we have embedded in our mental health efforts, as well as our suicide prevention efforts. So Hopeful Minds is available, again, to any South Carolinian. All you'll do is click or search hopefulminds.crediblemindcom. You'll get to a front forward-facing loading page. It'll ask you what county the individual lives in. All they'll do is click that county. So for me, that would be Richland. And then it'll ask me, is there anything in particular you want to look for? And it gives a list of topics, or you can just say other, and then it opens up the entire website. So when you go up to this website, and Jessie, if you'll go to home for me. There we go. So when they go onto the home screen, you'll see, they'll scroll right back down a little bit more. Nope, sorry. Show the top of it. Yeah, there we go. You'll see that it has the two links to the screeners that Jessie was just referencing. The adult one on the top, and then the youth and child one underneath that. So if you remember no resource, any other resources to share with your patients and your staff, please remember this one, because everything you're going to need, all the things that Jessie was talking about, how do I access mobile crisis, 988, the crisis text line, these screeners, all of these things are going to be here in this one spot for anyone in South Carolina. So we have flyers that have QR codes that you could post around your facility that can be mailed to you. We also have little cards that we could send you the information so you could get those printed that explains them. They're like business card size. We encourage you on your safety plans to make sure you list Hopeful Minds, because we know these are evidence-based, curated. They've done the hard work for you in finding the best resources regarding a certain topic. And they do it in a way that allows lots of different ways of learning. So for some people, they may want to read articles, research articles, or blogs. Some people may want to listen to a TED Talk or a lecture or a video to learn about something. Some folks may want to do assessments to say, what is my resiliency like right now? How is my family functioning? Jessie mentioned parents maybe not always knowing how much how well or how poorly their child is doing and what level of care might they need. So they may take an assessment on ADHD or anxiety. There's also the new learning lab where you can take some courses on there that will be launched. And again, this is totally free. The other thing that we wanted to show you was the additional support and resources page. And so you'll see here we have things on right now in terms of 988, the Veterans Crisis Line. We've got the Trevor Project. Safety Plan app is there. We have again made sure that the resources here are valid and safe for you to use. If you would like your hospital facility or another resource that you know of that you would like listed here, please just reach out to Jesse and I. We'll just need your logo and a brief description and the web link to add to this, and we'll be glad and actually would love to be able to add you as a resource here. The other thing I wanted to just say is one of the reasons that I find Credible Mind such a valuable partner for us and why I wanted to do it statewide for South Carolina is that trust. I know I'm not going to worry about the resource, or that if my 12-year-old wanted to come on here and look at assessments or information, that I would feel safe with what he was researching. And so the other thing that is really interesting about Credible Mind and our partnership with them is that they've been very collaborative with us. So for example, in one of our inpatient facilities, when an employee died from natural causes, it was still a big grief episode for the staff and the patients around them. And so I contacted Credible Mind and said, can you load grief resources as one of the primary things on the homepage so they don't have to search for it? It's just right there. And within an hour, it was already there. So if there's something that occurs in our state, such as a hurricane or something like that, or political climate rallies or something that maybe escalate tension in a certain part of our state, if there's something like that that you learn of and you say, or that we learn of, we will ask Hopeful Minds to make sure they load those resources that are even more easily accessed from this website. So I just want to make sure, again, please use Hopeful Minds. Please give it out. Use it and encourage it when people aren't doing well, most certainly. But use it and encourage it when they are doing well so that you're putting more money, coping skills coins in their piggy bank. I know my rheumatologist said, Jennifer, you need to be taking some Tai Chi. And I said, well, I'm going to look on Hopeful Minds and see if they have Tai Chi videos. They did. I started doing 3-minute videos at lunchtime or a break just to kind of relax the muscles in my body and kind of move a little bit. We have pulled it up at staff meetings to encourage self-care, to be that role model for why we use this. I have pulled it up with patients and explored with them and showed them how to do it. Also, if you have staff that want to be able to look up something like dialectical behavior therapy, there are videos and educational videos about the skills on there that you could point your patient in the direction of, or your staff could watch those to become more familiar and stronger in their skill set. So again, we are very fortunate to have this in our state. Other places in the country go, gosh, how did you even get it? I'm struggling to get my county to think that we matter enough to do it. And so please take that message home with you with these resources, is that your well-being matters, and the well-being of your patients and your stakeholders.
Thank you, Jennifer.
Well, thank you both, Jesse and Jennifer. Thank you for your time today. We really appreciate you all providing this wonderful information and resources. We do have a couple of minutes. If anybody has any questions, feel free to include them in the chat, the question and answer feature. And it is a fairly small group, so you are more than welcome to raise your hand. And if you'd like to verbally ask a question, we do have a couple minutes. And I will just mention, I have the contact information up on the screen, Jennifer's information as well as Jesse's. So if you think of a question after today, they are, as you saw today, a wonderful resource, and have a great wealth of information. And so thank you for providing this information. We will also send out an email to all participants. We'll include the presentation slides, links to the resources provided today, and we will also provide a copy of this recording of the webinar and post it on our website.
And I know I saw Karen Swaim.
Hey, Karen.
Muted.
Hi.
Karen, before you say that, I do see Mandy, thank you for the message in the chat, but I also want to highlight that Lexington Medical Center was the first healthcare organization to partner with the American Foundation for Suicide Prevention and Safe Side Prevention to roll it out throughout their entire healthcare system. And they were the first hospital system in the country to do that. So they are a testament to, Mandy's been busting it, trying to get it rolled out everywhere, but they are a testament to that it can be done and the positive outcomes when it is done. So I just wanted to give that shout out because it's another hometown example of being able to do this work.
Any questions? Karen?
Yes, Nan, you just said you're going to be sending out links to the resources, but I just wanted to make sure that I heard right. The way to get to the print resources is, I guess, to go on the OSP's, the DMH OSP site, and then I'll see a link to print resources.
Mm-hmm.
Okay.
Yes, and I put the direct link to that particular tab also in the chat as well.
Oh, okay. I don't know how to access chat links after a meeting's over.
We'll send it in the email. I'll
Okay,
make sure that
okay.
it gets put in the follow-up. So no worries about that. We'll make sure that you get that.
Okay, thank you. I also like the focus you put on hopeful minds, which I had somehow missed and not been aware of. And it occurs to me I can put it as a resource in the recommendations on my psych evals and bring it to patients' families' attention.
Absolutely.
And I can talk about it in group with the teen girls and demonstrate it to them. And anyway,
Yeah.
Thank you, ladies, for all your time. Y'all have a great day. Bye-bye.
Yeah, thank you. Thanks for that great feedback. We hope I'm sure this was very helpful. So thank you so much for that positive feedback. This was great information. And as I mentioned, we'll send out links to all these resources. If you have any questions, feel free to reach out to Jesse or Jennifer. And if you have any specific questions about the award metrics or anything with the Zero Harm program or Zero Harm Awards, my information is here on the screen. But thank you all for your time today. Thank you for your engagement, and be sure to register for the webinar that we will be having July 24th, where we will be giving a very comprehensive review of the required metrics for the Zero Harm Awards this year. Thanks. I hope you all have a great day.
Thanks, everyone.